and welcome to Floyd Productions' Fears vs. Phobia.
Today, we will be telling you the difference between a fear and a phobia, and we will also be answering questions relating to this topic.
So what exactly is a fear? A fear is an emotional response to a real or perceived threat. Fears are common in the population and are often normal, or at least innocuous, reactions to objects or events. For example, in the beginning of the clip, some of you may have experienced fear from the pictures that appeared on the screen. Factors that could cause fear are a potential for pain or an unrecognizable event. Biologically speaking, the amygdala, organs in the limbic system, detect such possibilities and send the signals which generate the fear emotion, which sets off avoidance activities. Fear acts instantly. It will stiffen your muscles before you can walk to the edge of a precipice. While fear signals act swiftly to avoid danger, they intensify when danger is unavoidable. In such situations, fear signals inhibit conscious thinking and set off subconscious searches for escape routes, while preparing the body to freeze, flee, or to defend itself. Together, the recalled images, the urges to escape, and the bodily preparations for stress feel unpleasant.
So now, what is a phobia? A phobia can be described as an irrational fear, a kind of anxiety disorder in which a sufferer has a relentless dread of a situation, living creature, place, or thing. People with phobias tend to go to great lengths to avoid their certain phobias. There are all sorts of different phobias, ranging from phobias of specific creatures or even phobias of public space. However, to summarise it all up, phobias can be separated into three different categories. The first, specific or simple phobias. These are the most common phobias and involve the fear of specific living creatures, situations, places, activities, or objects. Some examples are a fear of spiders, arachnophobia, a fear of small holes, trypophobia, and a fear of confined places, claustrophobia. The second is social phobias. People who suffer from social phobias, often referred to as social anxiety disorder, find it difficult to be physically present at social events or in situations where social interaction is unavoidable. For example, going to a party. The third is agoraphobia. This last category can be seen as an extreme case of phobia. People who suffer from agoraphobia are frightened to find themselves in situations where there is no escape. They have a fear of being somewhere where there is absolutely no help from other people. Examples may include the fear of travelling in a bus or train, going to a large shopping centre, or cinemas. People who suffer from a severe case of agoraphobia may find it very unbearable to leave the comfort of their own home.
So, why do people get phobias? There is a strictly biological component to phobias. A quick look at how the brain works when phobic people are triggered suggests the problem. When worrisome stimuli get to the brain, there are two ways they can go: to the amygdala or to the sensory cortex. The sensory cortex is a calm, rational part of the brain. It casts around the rest of the brain for more information and looks at general knowledge, present context, and past experience before it reacts. The amygdala, on the other hand, is a part of the brain that gets an unpleasant stimulus and screams, "What are you doing? Run, stupid." When people say that phobias aren't normal, they're right. The amygdala is not there to be rational. It's there to get results, and it does, often in the form of a panic attack. When it comes to the reasons why the amygdala is triggered at the sight of, say, a rat, the psychiatric community gives a big shrug. The top four answers are genetics, trauma, overall stress, and the combination of the three. The way science arrived at these answers is much more interesting than the answers themselves.
So, what are the signs and symptoms of someone experiencing a phobia? These observations are the most common things to happen to someone while experiencing a phobia: pouncing or racing heart, shortness of breath, rapid speech or inability to speak, dry mouth, upset stomach or nausea, elevated blood pressure, trembling or shaking, chest pain or tightness, choking sensation, dizziness or lightheadedness, profuse sweating, sense of impending doom. A person with a phobia doesn't have to have panic attacks for acute diagnosis.
Of course, treating a phobia is possible, and there are specific ways to do it. These are the two most commonly practiced ways to treat someone who is diagnosed with a phobia. First, the cognitive behavioural therapy. Cognitive behavioural therapy, CBT, is the most commonly used therapeutic treatment for phobias. CBT involves exposure to the source of the fear, but in a controlled setting. This treatment can decondition people and reduce anxiety. The therapy focuses on identifying and changing negative thoughts, dysfunctional beliefs, and negative reactions to fear. New CBT techniques use virtual reality technology to safely expose people to the sources of their phobias. Second is medication. Antidepressants and anti-anxiety medications can help calm both emotional and physical reactions to the fear. Often, the combination of medication and professional therapy makes the biggest difference. If you have a phobia, it's critical that you seek treatment. Overcoming phobias can be difficult, but there's hope. With the right treatment, you can learn to manage your fears and lead a productive, fulfilling life.
The Little Albert experiment was a case study showing empirical evidence of classical conditioning in humans. The experiment was conducted by John B. Watson, who studied behaviorism, in the early 1900s. During this study, the aim was to condition a phobia in an emotionally stable child. For this study, they chose a 9-month-old infant from a hospital who was referred to as Albert. It is important to state that this experiment was extremely unethical and would not be allowed to be conducted under current-day standards. Before the experiment, Albert was given a series of baseline emotional tests to test the emotional stability of Albert.
The first test was a dog.
Now the monkey. Followed by burning fire. Now a white rat. Now the rat is accompanied by a loud sound which causes the child to be distressed. And again. And once more. These large sounds condition a phobia into Albert. Subsequently, any furry object, or in our recreation, any white object causes Albert to be extremely distressed.
This case study is important to our topic because it demonstrates that emotional responses, and in this case, fears and phobias, can be conditioned into humans.
To conclude, a fear is an emotional response to a real or perceived threat.
Whilst a phobia can be described as an irrational fear, a kind of anxiety disorder in which a sufferer has a relentless dread of a situation.
Thanks for watching.